So you call the office, you're ready to make an appointment for Botox, and the question in the back of your mind is how many units of Botox am I going to need and how much is it going to cost? So let's talk about what is the average units that you need to treat a certain area. So I'm gonna give you a ballpark estimate, but your results are gonna be based on your own unique and individual anatomy. I'm Dr. Lynn Neiman. I'm a board-certified anesthesiologist and aesthetic medical provider in Winchester, Virginia, in my practice called Blossom Medical. I'm so excited that you tuned in to be a part of this conversation today. And I'm really excited to demystify some things for you so that you kind of understand how Botox works and how we decide how many units to place in certain areas. Remember, I am a physician, but I'm not necessarily your physician, and everyone practices aesthetic medicine with a little bit of artistry and what works well in their hands. So obviously, have this conversation with your provider, but I hope to give you some good guidelines today so you know what to expect when you go in. One of the things that my patients always ask me, and they always get concerned about, the number of units that I'm recommending. And units are like, think about them like milligrams of ibuprofen. If you had a really bad headache, the anti-inflammatory, so that pain amount dosage of ibuprofen that you would need would be 600 to 800 milligrams of ibuprofen. So if you took 50 milligrams of ibuprofen, are you taking ibuprofen? Yes. Should you expect to get a result for your headache with 50 milligrams of ibuprofen? I'm gonna say probably not. So there's just a certain amount of a medication that it takes to give you a result. So with Botox, I want you to get it out of your head that a certain amount is just too much or too scary, or that less is going to be better. With Botox or with Dysport or any of those medications, less isn't always more. It takes a certain amount to treat a muscle and to treat a muscle group, and we want that treatment to look natural and balanced. And so if we shortchange the number of units, one of two things could happen. One, you might get a really short treatment, so you don't get your investment out of that. If your treatment is really shortened because you didn't have enough units in order to give you 3 to 4 months worth of treatment. And the other thing is that, so number two is that you might not have a balanced treatment. The best Botox treatment is one that's really undetectable, that doesn't scream from across the room that you've had Botox in any areas. And that just takes thinking about the ways that muscle groups work together and then treating those muscle groups as a unit. And so sometimes actually treating more than one specific area is a more natural result than treating one area in isolation. So those are just some guidelines to go into, and we are going to talk nitty-gritty here in units. If this is content that you like, I would absolutely love it if you would subscribe below and like, and that will keep this kind of popping up on your radar when we put out new videos so that you can learn some more information, just to be well educated about aesthetic treatments and have good information so you can make great choices in the future. So let's start with the upper face. So to let you know, there is FDA recommended dosing for Botox in certain areas of the face. So I'm going to talk to you about what I typically do, what FDA dosing is, and kind of what a range is in different muscle groups. So I actually have a Botox treatment done, and so I can't actually make all the faces, so you'll have to just maybe make them in the mirror yourself, or you'll know what I'm talking about. But a lot of patients will come in complaining about their 11 lines. So when you make that frowning or concentrating face in the middle of the forehead, that area takes, in most women, about 20 units to treat, and then to also have that treatment last from 3 to 4 months. 20 units is actually where I start with most of my patients, in the glabellar complex, that's what we call that. And that is going to give a little bit of a lift to the inner corner of the brow and also just minimize those frown lines. So 20 units in the glabellar complex. Sometimes if someone has strong muscles, that amount of units may go up from there. So it may go up 22, 24, 26 in some of my female patients, 30 in some of my male patients, but 20 is a really good starting point just for you to know. That is the typical and that is the on-label FDA recommended dosing for the glabellar complex. The frontalis muscle is the muscle that spans our forehead and is the only muscle that actually lifts our eyebrows. That muscle is so different from person to person. And when you look in the mirror at home, you can make an assessment. Is your forehead, is it a little bit smaller? Is it a little bit larger? Do you have really strong muscle movements there? Do you have only a little bit of movement there? The on-label, so FDA on-label dosing for Botox in the forehead is 20 units of Botox. I don't always use 20 units of Botox. Sometimes I'm really trying to get someone some brow lift. Sometimes they have a really narrow forehead and I'm trying to really minimize their eyebrows feeling low. And so my typical dose on the forehead is anywhere between 12 and 20 units of Botox. So that's pretty typical for where I end up. But again, on-label dosing, 20 units on the forehead. The on-label dosing to treat crow's feet, so that muscle that goes around the eye called the orbicularis oculi, that is on-label dosing again, 12 units per side, so 24 units total for the crow's feet. That's including giving you a little brow lift by treating that upper outer corner of the orbicularis oculi, and then also treating around the crow's feet. One thing I want to say, crow's feet are kind of an interesting place to treat. I actually really love to see some crow's feet when I'm talking to someone because to me that signals they're paying attention, they're interested. And so for my patients, we talk about what their expectation is, whether or not we get rid of all of their crow's feet or whether they want to see some movement, some life, and a little bit, if a little bit of crow's feet is acceptable to them to see. And sometimes for expression, that really is a beautiful thing. So I'll come down on my dosing. So again, typical dosing for me per side is anywhere from, I would say 6 to 10 is pretty typical. Again, on-label dosing per side is 12 units, just for you to know. Sometimes people with really nice, gorgeous cheeks, if we treat very heavily around the eye and you smile, it can create a funny little shelf because this muscle of your cheek really gets contracts strongly and tightly because the muscle by your eye isn't contracting as much, and it can form a funny little shelf. So sometimes your own anatomy will let us know how heavily we can treat around the eye without creating something that looks a little bit one of those giveaway signs that you've had a Botox treatment. So assessing around your eye is one thing, assessing for what you want and the result that you will find beautiful, and then also making sure that that goes with the rest of your anatomy will help to determine your dosing. Some people, when they smile, will get a little thickening right underneath the eye called a jelly roll. And we can treat a little bit with 1 to 2 units of Botox in that jelly roll that will help that portion of the orbicularis oculi muscle just relax a little bit. And as that does, it will just kind of keep that little thickening or that little swelling of that muscle from occurring during a large smile. And it also helps to make eyes look a little bit bigger. So in photographs, when you have a nice big smile, it may make your eyes look a little bit bigger, which is a result that some people want. So 1 to 2 units per side for your jelly roll. Another place that we can treat with Botox is the nasalis muscle, or things that are called bunny lines. Some people, when they smile, they recruit this muscle at the top of their nose. It creates really cute little bunny lines, but one of the things about bunny lines is that sometimes that starts to pull on the orbicularis oculi and forms some crow's feet that come underneath the eye or some fine lines underneath the eye. So we can treat the bunny lines, and depending on the severity of the bunny lines, I usually start with about 2 units, but anywhere from 2 to 6 units per side, we'll treat those bunny lines. For some people, I'm going to move down the face here. For some people, when they smile, you can see a lot of show of the gum of the upper teeth when they smile. Call that a gummy smile. We can treat a muscle that comes from the lip all the way up the nose called, for shorthand, it's called LSAN, levator labii superioris eloquae nasi is the name of that muscle, and that pulls that lip up tightly and creates that show of the gums when you smile. And we can treat that muscle right by the sides of the nose 2 units typically on both sides, and that will drop that lip. So we just don't see as much of the gum when you smile. We can do a lip flip as well. You may have heard about that. So a lip flip is allowing a little bit more of that pink part of the lip to show, probably about 1 to 2 millimeters. So it's not adding volume to the lip like lip filler would, but it's adding a little bit more pink show to that lip. So typically that runs anywhere in my practice from 1 to 4 units per side. So that's to do the lip flip, that's going to be anywhere from 2 to 8 units total. In our practice and in many practices, if you go in, there may be just a standard kind of 1 fee for just doing a lip flip. And so that might be something that you ask for. Lip flips are actually really, really an effective treatment as part of your toolbox that you're using to treat those vertical lines, smile lines, straw lines, smoker lines, some people call them. I call them lifelines because absolutely when you're talking, smiling, making expressions, eating with friends, laughing, doing all those things, that's going to cause those lines to appear over time. So if you're a person who has those vertical lines and you say, I've never smoked a day in my life, absolutely you haven't. It's just life. And we can treat those lines with a little bit of Botox in that upper lip. So that might be a treatment that you're interested in at some point. On the lower face, one of my favorite places to treat is absolutely just around the lower face. There's a muscle on the chin called mentalis. As we age a little bit, our mandible tends to reabsorb, so the bone underneath reabsorbs, and that muscle tends to get a little bulky or hypertrophies and pulls a little bit upwards. Isn't that interesting? Pulls upwards. But it creates that mental crease or that little witch's crease that some people call it right across the bottom of the chin. When we relax that muscle, we relax the tension on that crease in the skin, and we also relax the way that that muscle tends to pull and create almost like an orange peel expression on the lower portion of the face. So we can smooth out that chin, elongate that chin, and reduce the deepening of that mental crease. And then we have 2 other muscles that pull down on the corners of the mouth. So as those muscles pull down, they're called the depressor anguli oris, and those muscles can create kind of a downturn at the corners of the mouth called the oral commissure and create or contribute to the creation of that marionette line. So typically, anywhere from 2 to 4 units per side to treat the depressor anguli oris, and anywhere from 4 to 6 units in the mentalis muscle. When you're doing that as a unit, I typically like to stay around 12 units doing that lower face. Other areas that people come in to get treated really commonly with my patients is their masseter muscle. So the masseter muscle we can treat for 2 reasons. One, for facial slimming, and the other one is if someone has a history of TMJ and they're under the care of a dentist or an oromaxillary facial surgeon, or if they have bruxism or just they really clench a lot. That joint is fine, but they really overuse that and they're getting some wear and tear on their teeth. So that masseter muscle has a wide range in acceptable treatments, anywhere from 5 to 30 units per side we're going to use in order to treat that masseter muscle appropriately. With the rest of our Botox treatment on the other portions of our face, typically they're going to last 3 to 4 months. Masseter muscle, that should last 4 to 6 months for your treatment, especially if we're using that higher dosing. So that's just something for you to know. If you're having regular treatments done with your Botox, masseters might be something you can do every other treatment. So that's something for you to know. We can also do bands on the neck. Mine stand up really good. Ooh, all those little platismal bands that come to the surface. We can actually, so the platismal muscle is one that starts on your collarbone and it ends on the jawline of your face. And as that muscle contracts, all of our muscles, when we contract, they move towards the starting point. So as that muscle contracts, it actually pulls down on the bottom of your jawline. And so we can do something called a Nefertiti lift, which is treating the place where that platismal band kind of pulls down on your jawline to sharpen up that jawline. And we can actually treat those bands themselves. Typical Botox treatment for the bands, about 8 to 10 units per platismal band. And generally speaking, we don't want to treat more than about 4 in one treatment because we don't want to make the neck overall feel a little bit tired or a little weak. So we have to keep in mind or bear in mind the number of units that we're using in the platismal band. And we can also take a couple of units, maybe 4 to 6 units, and hyperdilute them. that is a great way to treat those little necklace lines that go across the neck. It's a beautiful treatment to help to kind of airbrush those lines out. And the last dosing that I wanted to give you is for hyperhidrosis or armpits, and that's typically 50 units per side. Should last for 6 months, and that is one of my favorite places actually to treat my patients. So if you are someone who suffers with excessive sweating, it can be a life-changing treatment to be able to have that BOTOX really reduce your sweat production and really keep you with dry underarms for up to 6 months. So that is the dosing, kind of head to neck and underarms. And I hope that that's helpful for you to just kind of know. Again, the thing is, when you go in for a treatment, your provider should map specifically for you where you are going to be treated, and they should tell you exactly which neurotoxin you're getting, whether it's BOTOX, whether it's Dysport, Xeomin, Jeuveau, Daxxify. Have that discussion with your provider. Know where they are treating, know what they are treating you with, and know how long you should expect that treatment to last. These are discussions you should be having with your provider. Any provider, I think, who is going to be a good, careful, and passionate provider is more than happy to have that discussion with you so that you know that you are actually able to have a partner in your health care and in your aesthetic care, and that is so very important. I hope that this is information you found helpful to you. If it is, I would appreciate it, again, if you would like and subscribe below. If you have any friends who are thinking about getting BOTOX, and this might demystify how many units of BOTOX they might need in a certain area, hopefully they'll find some information here that's helpful. I would love it if you would share that with them. And if you have any other specific questions, definitely leave them in the comments below. If you happen to be in the Northern Virginia or Winchester, Virginia area, I would happily see you in a consultation and go over facial mapping with you and talk to you about specifically how many units you need for a good BOTOX treatment. I would say, again, for the upper face, let me just repeat myself, for the upper face, on-label FDA dosing is 64 units. My typical patient, when we're doing an upper face only, tends to run somewhere between 40 and 60 units. When we're doing full face, that changes because we're adding on additional units, maybe around the mouth, maybe in the lower face, maybe on the neck. But hopefully that gives you kind of a good ballpark estimate so you know what to expect when you go in for your own appointment. If you're not anywhere near the Winchester, Virginia area and you would like to have a virtual consultation with us to go over skincare, we can absolutely set that up no matter where you live in the US, and we'd be more than happy to talk with you about ways that we can help you meet your aesthetic and skincare goals. Thank you so much for tuning in. I really hope this content was educational and it arms you with the information so that you can go forward and make great choices for your own aesthetic care. Hope you have a beautiful day, and thanks for tuning in.